Hi, everyone. My name is Dr. Boyana Yankovic Weatherly, and I'm a board certified internist and integrative medicine physician. Welcome to the webinar on thyroid health. I'm excited to talk to you about this topic because thyroid is really one of my favorite glands and one of my favorite topics. And unfortunately, it is thyroid health issues are a very common problem in the Western world. And we're going to talk about why as well as what we can do about this. Thyroid health is certainly something that concerns and affects many of my patients. So this is something that I'll be sharing my clinical experience about, but we'll certainly also be sharing what the evidence shows and what are some of the things and some of the questions that you may want to ask your physician or your healthcare professional to really ensure that you're doing everything you possibly can to achieve your thyroid health, and to also make sure that if you do have thyroid disease, specifically hypo or hyperthyroidism, that it is being managed accordingly, and that you're really deriving all the benefits as well as alleviating the symptoms if you already have symptoms of thyroid disease. So what I'm going to do is I'm going to be switching gears a little bit. I'm going to go ahead and share my screen, and I'll stop the video. So we're going to dive right into the presentation. All right, so here we go. And you should be able to see my presentation screen now. All right, so we're going to talk about how you can maintain thyroid health, as well as what are some of the areas that you should be aware of and really address with your qualified healthcare practitioner if you already have thyroid disease, and how to best go about managing this. So this is just a disclaimer that I'm sure all of you are aware of, that this webinar does not in any way imply a doctor-patient relationship, and everything that I'm sharing is purely for information only, and I'm not going to be providing any medical advice, but I certainly welcome any questions that you might have that I can help you answer, and certainly happy to provide any guidance that in terms of anything that you may want to discuss with your healthcare professional. Now, before I dive into the thyroid presentation, if you've heard any of my talks before, the likelihood is that you may have heard why I went into integrative medicine, why I practice with the approach that I do, meaning that I combine the conventional medicine as well as the integrative and functional medicine modalities. But for those of you that may not be familiar, I'm going to share the story just to give you a little bit more context of my philosophy when I'm practicing, and really how it is that I am able to provide this comprehensive care and really take into account all evidence-based modalities and really inform and empower my patients to the best of my ability so that they can make decisions for their own health that will really serve them best. So really my journey started when I was in medical residency, and I was actually pregnant twice when I was a medical resident. I had a conversation with my OBGYN at the time, and I was ready to have a baby, ready to be a mom, but at the same time was very concerned about the busy schedule that I was in and that was ahead of me. And so when we were talking about the timing of all of this, he said, "Listen, Boyana, there's never the right time. It's like the Nike slogan. Just do it." So I just did it. I had my babies. But it definitely came at with a transformative lesson, and with something that really fundamentally changed the way that I look at medicine as a patient as well as a physician. And how this really started is that while I was a busy pregnant resident, I was running around doing 30 plus hour shifts every 3 or 4 nights, taking care of very, very sick patients, and really having zero time for self-care, for sleep, for exercise, for stress management, for nutrition, and all of the things that we talk about really as pillars of health and as foundations of health. And now I know that without that, there really is no health. There's no magic pill. there's no magic supplement, there's no easy solution, right? It does require work on our part, and it does require a consistent practice of healthy habits. But at that time, however, I wasn't necessarily practicing those habits. And so while I was doing my best to keep myself nourished and hydrated by carrying a water bottle in the white pocket of my coat and some almonds, an apple, and a banana, I was not prepared to deal with burnout and exhaustion that was to come. And as this was going on, and as I started to experience these cumulative effects of burnout, exhaustion, long work hours, I started to grow more and more concerned. And my concern primarily was for my baby and for my pregnancy. On top of this, my baby was measuring very large. In fact, both of my babies were large. One was over 10 pounds. And my OBGYN presented the idea of a C-section. And being of a mind that I am, I really wanted minimal to no intervention unless it was absolutely medically necessary. And so this kind of freaked me out, the fact that I now had to think about, okay, this is possibly going to end in a C-section, and I may have this medical intervention. And of course, there are complications associated to me as well as the baby, of course. And so this culminated in one night, me waking up in the middle of the night, being extremely concerned and worried and upset. And being the person that I am, I, of course, went on PubMed, which is a large medical database, and started Googling and PubMeding all the evidence on maternal long hours, shift work, night work, burnout, and complications of pregnancy and premature labor. And unfortunately, I found plenty of evidence for this. And so in that moment really was a critical point. I could be a victim of these circumstances, and I could say, well, there's nothing I can do, and be miserable, essentially. Or I could take matters into my own hand and be proactive and seek ways in which I can alleviate some of these stressors and empower myself to live the healthiest life that I can and do the best that I can to provide my baby with a healthy, nourishing environment. And so I made that decision in that moment at probably 2 or 3 in the morning, sitting at my computer, that I was going to do something about this. I was going to be proactive about my health. And this was really the first time that I thought of it in this way, because if we think about it, healthcare, unfortunately, is primarily based on the model of sick care, really, and being reactive about treating disease. And while this can be extremely helpful, because let's say once we detect cancer, well, we do have some fantastic innovative therapies. Unfortunately, many are toxic, but we're seeing some great advances in medicine that can treat disease, that can cure disease, that can bring it to remission. But they don't really get to the root cause. And this curiosity of integrative and functional medicine specifically is, how do we really understand what was the cause of this disease process? And then how do we go back and repair this cause? How do we address this cause? And so not really knowing that I was doing this, I essentially was doing this. I was proactive about ensuring that I don't have any complications of pregnancy, and that I do the best I can, that I can take care of my fetus and myself and the pregnancy. So I started applying some integrative medicine modalities that included chiropractic care, acupuncture, hypnotherapy with a birth doula, and prenatal yoga. And over time, I started to notice a shift in my body, a shift in my mind, feeling a sense of lightness, feeling a sense of hope, optimism, empowerment, knowing that, yes, there are a lot of barriers and it's difficult, but I'm in charge of these circumstances, and every single area that I can control, I will control. And then of course there will come things that are beyond my control, but that's okay. I'm going to take care of things that are within my control. And I found that this was really the first critical point where my mindset shifted on what healthcare should be, but also on what I should be providing to my patients. So, a couple of years later, after completing my residency training and starting in primary care, I noticed that I was seeing a lot of patients with chronic problems, with chronic symptoms, and many of them had not been addressed with conventional medicine. And certainly the root cause was not investigated. And I was seeing patients with chronic fatigue who seemingly had normal lab work, but they were just not feeling themselves. They were not feeling normal. Patients who just couldn't lose those last 5 or 10 pounds. And there was just something that changed, that shifted in their metabolism, and they couldn't figure out why. I was seeing patients that were suffering from depression and anxiety and were in increasing doses of medications, including benzodiazepines, which have a great deal of side effects and can be addictive. And I was seeing a lot of patients with thyroid problems and gut health issues. And these are actually linked, and we're going to talk a little bit about how. But this got me very curious because, for instance, there was a subpopulation of my patients with thyroid disease that were adequately treated with thyroid hormone. Their lab tests were normal, or at least the lab tests that we check in the conventional setting, and they were just feeling off. Again, whether it was still feeling like their energy was low, they might have still felt depressed, or cognitively, like that they're mentally still kind of foggy and not totally clear. They might have felt that it was still difficult to lose weight, again, despite proper treatment of hypothyroidism or underactive thyroid. And they might have felt that they were still having some gut issues and constipation that can often be triggered by underactive thyroid. So we're going to talk about all of these things and how we can address them in an integrative way, in a proactive way, and what are some of the lifestyle practices that you can adopt to really support yourself, but also some of the key things that you want to ask your healthcare professional to perhaps check for and look at. So as you can see, my road to what I do today, practice internal, integrative, and functional medicine, and provide this level of comprehensive care, was certainly not linear. As a pregnant internal medicine resident, I had no idea that this was going to be this road. It really was more of this windy road here at the bottom left corner that was full of twists and turns and shadows and things that I wasn't quite sure how I was going to navigate. But eventually it led me to this place. And then, of course, there still was sunshine at the end of the tunnel. And thankfully, I did have these beautiful babies naturally and with no complications. So now let's talk a little bit about foundations of health and healing in the context of this topic. And I'm going to be addressing a lot of these. Unfortunately, some of them are outside of the scope of this presentation today, but there are certainly topics that I talk about, whether it's on social media, in my newsletter. So definitely, I would encourage you, if you're interested in this and if you find this valuable, feel free to sign up for my newsletter at drboyana.com. But also feel free to join my Facebook group, Dr. Boyana's Thriving in Health and Life group, where I deliver content in the scope of these different areas, with the goal of really helping you live your best, healthiest life. So what are some of these foundations of health and healing? Well, we know nutrition, right? We all talk about nutrition. I'm going to share some guidelines today as they pertain to thyroid. Movement is extremely important. Sleep, I generally recommend at least 8 hours of sleep. 7 if you really must, but definitely no less than 7 and at least 8 hours. There's a very rare small population of people that may be able to get away with less, but there are a number of studies that sleep actually helps regulate our immune system, obviously our central nervous system and our cognition and memory, and many other body processes. So sleep is very, very, our appetite, our metabolism, sleep is extremely important in all of these different domains. Mindfulness and stress reduction are very important. And most of our population, and I'm not going to be sharing these slides today, but in some of my other talks, I share data on stress and what are the top stressors and what can we do about this. We know that most of our population is stressed for a variety of reasons, and we're just kind of used to it. We accept it. But this is really not something that is normal. This chronic stress is very, very toxic to our body and mind. And so strategies that we implement every single day to channel and manage this stress are crucial if we want to live at the highest level of our health. Having a tribe and a community. Now, this has been shown in studies that people who are socially supported, people who have a close group of friends and family members, they live longer, they're happier. So this is very, very important. And whether this is professionally or personally, it's really important to have a tribe in really every domain of your life, because no one does it alone. A sense of growth and purpose, right? We all want to feel that we're contributing and that our life has meaning in some way. So this is something that I frequently discuss with my patients. What is their purpose? Do they feel that they're living their purpose with their life? And if not, this is something that's very, very important to examine. Because again, this affects our body. This affects our nervous system. This affects our gut, believe it or not. And so these are all important domains. And I talked about contribution, a sense of joy. What gives us joy? So there's one exercise that I sometimes do with people where I ask them, and you can definitely do this for yourself. I ask them, write the 5 things that bring you joy, that you absolutely love doing, and just, put a smile on your face, make you laugh, make you happy. And then write 5 things, like 5 top things that you have to do today. And compare if there are any overlapping items. If there are, congratulations, that's amazing. But we need to bring at least one thing daily that brings us joy. No matter how simple, no matter how brief it is, it's very, very important to consistently practice and be mindful of joy in our lives. Nature. Exposure to nature is very, very important. And I know this can be difficult for those of us living in the cities. In fact, now I live in New York City, and this is something that I constantly seek, because it is hard to be exposed to noise pollution, to be exposed to tall buildings and not see the sunshine, not see the sky. Our brain and our eyes are used to seeing natural colors, blue and green, and it just changes our mood when we're surrounded by nature. So seeking out nature, whether it's even just going to the park or getting outside of the city for a day on the weekend, anything you can do, or being near a body of water, anything you can do to practice being in nature is going to help you get to those subtle shifts. Toxin reduction. Again, this is a topic on its own, and something that I also talk about and discuss in my newsletters frequently, as well as in the Facebook group. But toxin reduction is something that is really underrated. Oftentimes we don't think about it. We may focus on nutrition, movement, and sleep and say, well, I eat a plant-based diet, I exercise every day, I get enough sleep, but then we ignore the toxins. And this is very important, whether it's toxins in our food, whether it's toxins in the food packaging, or let's say bottled water, toxins in our household products or personal care products. So again, this is a topic on its own. A great resource is the Environmental Working Group, which I'm on the board of, but I have no, they don't pay me or anything like that. So I happily endorse them. I think they're a fantastic group of scientists, and they provide some really phenomenal resources for how you can reduce your toxic burden. Spirituality. Now, this can be tied to mindfulness practices and meditation practices. But again, this is another area that people often turn to, and that actually has been shown to improve outcomes for people with a chronic disease, with a health crisis. So this is something that, again, if you do practice some form of spirituality, maybe just being mindful of that and how that may be affecting you. And then self-care, right? So self-care really encompasses all of these different things and really practicing all of these different foundations. And integrative medicine care. So having a qualified healthcare provider who can provide you with the evidence-based medicine and is also going to be curious and persistent to help you get to the root cause of why you're having the symptoms that you're having, or how to help you be proactive about your health and reduce the risk of chronic disease if you are at high risk of chronic disease. And for instance, with thyroid, we know that thyroid disease runs in families. There is a genetic component. So practicing healthy habits to reduce your risk of developing thyroid disease. Now, what is integrative medicine? Well, integrative medicine encompasses all of these different aspects. And some of the main points that here I want to focus on is that the patient and practitioner partner in the healing process. And this should be really the case for any type of medicine where the patient is empowered, the patient is informed, and the patient is able to understand the pros and cons of different therapeutic options, the evidence behind them, and then make an informed decision in the partnership with their physician or their healthcare practitioner. And then, as I mentioned already, we want to consider all dimensions of well-being and address them, not just mention them, but actually actively work on them. As I previously mentioned as well, integrative medicine is evidence-based, and it doesn't reject conventional medicine, but it also doesn't accept alternative therapies uncritically. So it really looks at what is the evidence, what's the level of evidence, what are the benefits, what's the possible harm, and then decisions can be made based on this analysis. And then the plan is customized to every patient. There's no one size fits all. We're so different in not only genetically, but also in our habits, in what our priorities are, in what our goals are. So a customized plan is really warranted when it comes to any chronic disease plan for either chronic disease management, reversal, or prevention. And then, of course, we always want to focus on prevention. Now, oftentimes people ask me, well, what is functional medicine and how does it relate to integrative? And is it the same thing or what is it exactly? The way that I see functional medicine is it's really a branch of integrative, because integrative really encompasses, it's really this umbrella term for modalities that, again, have evidence behind them and consider this comprehensive holistic care. With functional medicine specifically, the goal is to address the root causes of disease and to really assess the patient's biochemical and lifestyle factors. And there's some innovative specialized tests to specifically assess the biochemical factors. And functional medicine practitioner uses this data to create a plan that's, again, customized to the particular patient. And a recent study from Cleveland Clinic actually confirmed something that has been so obvious in the clinical setting, which is that health-related quality of life is significantly improved when patients are treated in a functional medicine setting. So this is really something that integrative and functional medicine should really, in my opinion, marry conventional medicine, and there should be a comprehensive care model that allows people to have these modalities, again, in a customized, evidence-based way, so that we give people the highest chance of healing and being empowered. So now let's switch gears and focus on the thyroid gland. And please don't let the diagram here of the thyroid gland intimidate you. We're not going to be going through the details of the pathways. It's really just to illustrate that iodine is something that's required for thyroid hormone formation, and there are certain things that can affect iodine. But more importantly, let's just talk about basics. Where is the thyroid gland located? Well, it's located at the base of the neck, and it's a butterfly-shaped gland, as you can see in the diagram. And the thyroid gland produces hormones that regulate the body's metabolic rate. So when we think about metabolism, right, we think about a number of different things, and the thyroid hormones really affect pretty much every single organ system. So they affect the heart rate. So for instance, people who have an overactive thyroid gland might be at risk of heart palpitations, increased heart rate, arrhythmias as well, that sometimes actually can be life-threatening or dangerous. The thyroid hormones also affect digestive function. So how well we're digesting, how our bowel movements are. People with an overactive thyroid gland may have frequent bowel movements and loose stools. People with underactive thyroid gland may have constipation. Thyroid hormones also affect our muscles. They affect bone density. So people may be at risk of impaired or lowered bone density and osteoporosis in the setting of thyroid disease. Thyroid also affects brain development. So this is something that's actually very important in a developing fetus and in childhood as well. But also in adulthood, hypothyroidism will affect cognitive function, it will affect the nervous system, and it will also affect mood. Typically, people with hypothyroidism can present with symptoms of depression and mental slowing. People with hyper or overactive thyroid can present with anxiety, panic attacks, insomnia, because they're so activated, they're wired. And they can actually have tremors as well because of the overactive nervous system. Whereas with somebody who is overtly hypothyroid or has underactive thyroid, they almost have this slowing of their nervous system and of their movements. Because again, the thyroid hormone is so important in driving that metabolic rate and driving all of these different systems in our body. So just to kind of cover this in the very, very basic terms, your thyroid gland takes iodine from your diet and it combines it with an amino acid called tyrosine. So the iodine enters here. It gets combined with tyrosine. And then the thyroid gland produces hormone T4, known as thyroxine, and T3, which is known as triiodothyronine. And let's just call them T4 and T3 just for simplicity's sake. And this is how they're normally referred to, and this is how you may see them in your lab report when your doctor runs thyroid function tests, as T4 and T3. So what happens with T4 and T3? And I should also say that the thyroid gland predominantly produces T4, and then a portion of T3 is also produced. But what happens is that it mostly produces T4, and then the way that we get T3 is through conversion from T4 to T3 in peripheral tissues, meaning in other tissues of other organ systems, such as the gut, for example. So the hormones are released into the bloodstream once they're made in the thyroid, the T4 and T3. They go into the bloodstream and they're transported to the different organs. And now this is where they control metabolism. Essentially, metabolism is conversion of nutrients and oxygen to energy. So a normal thyroid gland, as I mentioned, produces 80% of T4. So of this guy right here, 80% of T4 and about 20% of T3. But T3 is more potent. It's about 4 times more potent in terms of its action on the end organs. So this is why when we get to the end organs, so whether it's the brain, the heart, the muscles, the gut, this T4 to T3 conversion happens there. So that T3, the more potent hormone, can activate and properly act on those organs. So we're going to focus on hypothyroidism in this presentation today. Let me share with you some statistics. Hypothyroidism is more common in women, and it's estimated that 12% of the US population develops some type of thyroid disease. And as far as how much more common it is in women than men, it's been estimated to be about 5 to 8 times more common in women than in men, actually, by the American Thyroid Association. Now, as I alluded to earlier, symptoms of underactive thyroid, you can imagine what would happen if the metabolism slowed down, right? If everything just kind of slowed down because this T3 was not able to activate any organs. So metabolism slows down, right? We gain weight or we have difficulty losing weight. We get tired. We feel kind of sluggish. We are sensitive to cold weather because, again, we're not able to generate heat as well. We're not able to keep ourselves as warm because our metabolism is slow. We tend to have slowing of bowel movements and tend towards constipation. Our heart rate can sometimes slow down. So oftentimes, if I do see a patient with hypothyroidism, their heart rate can be in the 50s. Now, if you have normal thyroid function and your heart rate is in the 50s, it may just mean that that's normal for you. And it's because you're an athlete and you're physically active and it's always been that way. So definitely this is something to check and discuss with your doctor. They may experience dry skin. Hair thinning or loss is another very common manifestation of underactive thyroid. Women may experience menstrual irregularities or infertility. And then, as I mentioned earlier, depression is something that can happen, as well as high cholesterol, actually. So what are the typical treatments and what are the treatment options for hypothyroidism? Well, the American Thyroid Association recommends levothyroxine, which you may know as Synthroid. That's a brand name. But levothyroxine is this T4. So I mentioned before, thyroid predominantly produces T4, but then it has to convert to T3. So the standard of care is to give a synthetic form of T4, which then our body uses and then converts accordingly to T3. So this is the standard of care. And actually, most people feel an improvement in symptoms when they're treated on levothyroxine alone. And I should also mention that in pregnancy, specifically, the American Thyroid Association recommends only levothyroxine. Now, T3, which is the more active form, in some cases can also be added to the regimen. And this particularly applies to a scenario where, let's say, somebody has hypothyroidism and the doctor has confirmed this with labs, and we're going to talk more about lab tests on the coming slides. And let's say they're just treated with levothyroxine alone at first, and their labs come back a month later, labs are perfect, everything looks good on paper, but the patient is still feeling sluggish. They're still feeling tired. They're not feeling themselves. They have this brain fog. They're not able to lose the weight, and they're just still feeling off. And this happens, and it's estimated to happen in up to 10% of the patients. So what happens then? A doctor may suggest adding a small dose of T3, and a brand name that it's known as is Cytomel, but this is the liothyronine that I mentioned before, the T3, the more active form. And it is hypothesized that, again, this 10% of patients that still may have symptoms, even if they're adequately treated on the T4, it's hypothesized that perhaps these 10% are not able to adequately convert their T4 to T3. And we're going to talk about some of the factors actually that may influence this conversion. And so in some cases, people may be treated with T3, and then they find that their symptoms are much better. Some of the other options can include a pre-made combination of T4 and T3 so that you're not taking separate pills. And this is Armour thyroid or NP thyroid. And this is essentially ground up pig's thyroid, and where with the dose that you're taking in the tablet, you're getting T4 and T3. And again, this is something that's very, very important to discuss with your doctor, and something that should be customized to a specific patient in a specific scenario. So something to keep in mind and definitely discuss with your doctor if you have any concerns about this. Now, I mentioned, and this is another kind of busy slide, but we're going to get through this, and I promise you're going to understand it. And if not, just feel free to send me a message in the chat box, and I'll break it down to you. But this is something that I talk to my patients about, because I find that it's really important. Once we can make this information more accessible and more understandable, people understand, well, what is the rationale behind the treatment? What is the rationale behind the labs? And then again, this is where this empowerment comes back. You know, you understand what's going on. You're not passively receiving treatment, but you're actually partnering and adhering to a treatment protocol that you actually understand. So let's just talk about this, and then we'll talk about the factors here on the sides later. So we talked about the thyroid gland. We talked about that it produces this T4 and a little bit of T3, which is not illustrated here, but that this T4 can convert to T3. So how does the thyroid gland even know to produce T4, right? So it's got to get a signal to produce T4. So the way that the thyroid gland knows to produce T4, I apologize. The way that the thyroid gland knows to produce T4 is actually by being stimulated by this TSH. And I'm sorry, my cursor got frozen for a second, but this is the TSH right here. So TSH, which is known as the thyroid stimulating hormone, is a hormone that's produced by the pituitary gland in the brain. The pituitary gland produces this TSH, which then signals to the thyroid gland and says, you got to make more T4, time to make T4, and then the thyroid gland makes the T4. If for whatever reason there's excess T4, guess what happens? T4 as well as T3 signal back to the pituitary saying, stop the production of TSH, we got just enough, so the thyroid gland needs to slow down a little bit. So this is this really beautiful illustration of how our body purposely keeps a state of homeostasis or balance. So when we're checking on lab tests, TSH and T4, we have to keep in mind that if the balance is off, yes, there could be a disease process and something that we need to look at, but it also could be indicating that our body is trying to compensate in some way for something. And that's really, really important to think about and ask your doctor about as well. So now that we've covered that the thyroid stimulating hormone that gets produced by the pituitary gland signals to the thyroid gland to produce T4 or thyroid hormone, let's move on to the next stage. T4 is produced in the body, right? And then it's transported to these end organs. Well, guess what happens then? T4 can get converted to T3. T3, which is this 4 times more active hormone, can bind to receptors of cells, enters the cells, and exerts its effect on those particular cells. So whether the end result is making sure that the heart rate is up where it's supposed to be, or making sure that the bowel movements are normal, or making sure that the central nervous systems or muscles are working properly, this is really where T3 is going to exert that effect. But wait a minute, you may be wondering, what's this RT3? It looks like the T3, but it has an R. What does that even mean? So RT3 is reverse T3. So you can think of it as kind of something that it binds the same receptor, and we call this competitive binding. It competes for the same site. So you can think of it as like a shield. It just sits on the receptor and it's a shield and says, nope, you're not going to go there. You're not going to bind. You're not going to exert effect on this cell. Stop it right there. And so you may wonder, well, why would our body produce this reverse T3 to stop the normal function of thyroid hormone? Well, let's look at this list over on the left. If we're in a state of extreme stress or chronic stress, if there's a trauma, and again, it could be a physical trauma, it could be a serious infection, it could be surgery, it could be any type of trauma. If there's a very low calorie diet, let's say that somebody is consuming, if there's inflammation, somebody has an autoimmune disease, if there are toxins that we may have ingested. Now, whether this is a toxin, again, toxin could be an infection, a toxin could be heavy metal, a toxin could be, again, something that we've ingested from the environment. That all could cause more reverse T3 to be produced to put a block on this metabolism. And if you think about it, let's just look at one of the examples, low calorie diet, right? So let's say either because food is not accessible, right, which would be our ancestors, which is really how these evolutionary processes formed. But let's say it's our ancestor, and they haven't been able to find any food. They're hunter-gatherers. There's no food. Well, if there's no food, you want to slow your metabolism. You want to conserve all the energy you possibly can and really use it only as needed. And so you want to slow down the metabolism. How do you slow down the metabolism? Well, you produce this, and my cursor froze again. You produce this reverse T3, you block the activity of T3, and thereby block its action at the end organs. What about other factors that influence this conversion from T4 to T3? Well, again, stress is a big one. Any sort of infection, trauma, even radiation, actually. Some of the medications, let's say amiodarone, for example, that's a medication that contains a high iodine concentration. Fluoride, again, excess amounts of fluoride. Toxins, so we talked about mercury, so heavy metals, lead, pesticides, and then something like autoimmune disease. That's something that also can affect this conversion. I also put this arrow here for cortisol. So cortisol is our stress hormone that's produced by the adrenal glands. So cortisol can affect, so if we are, again, under a lot of stress, cortisol can block this conversion from T4 to T3, and it can encourage more conversion from T4 to reverse T3, meaning that, again, if we're under a lot of stress, let's conserve energy, let's slow down the metabolism until the stress passes and until we're safe, and then we can speed up the metabolism again. So again, evolutionarily, this may make sense. So sometimes, even in the setting of an imbalance and maybe even a slightly low T3 and an increased reverse T3, it may not make sense to supplement with extra T3. But what may make sense is address these factors right here. Find out, why is the conversion compromised? Why is there more reverse T3? Why is the T3 not able to penetrate and really act on these end organs to speed up the metabolism? So instead of just giving the body more T3, which clearly it's purposely trying not to produce, let's figure out what's causing this shift and repair it. So this is what we mean by looking at the root cause, investigating the root cause, and then addressing that root cause. So what about other factors that contribute to proper production? So what are some of the things that can positively affect our production of T3 from T4? Well, having adequate levels of nutrients. So it's important that we have enough iron, iodine. Iodine is part of these hormones, right? T4 has 4 iodine atoms. T3 has 3 iodine atoms. That's why the 4 and the 3. Tyrosine, right, which we mentioned is a building block. Zinc, selenium, which we're going to talk about, vitamin E, B2, B3, B6, vitamin C, vitamin D. So vitamins are very, very important, and minerals as well, in normal thyroid hormone production. And again, here we're mentioning more factors that can increase this conversion, T4 to T3, as well as factors that can improve the sensitivity of the cells to thyroid hormones. So now here on the left, I'm going to mention this briefly just because you may be wondering, okay, so when my doctor shares with me my thyroid labs, what do they really mean? And I'm not going to be talking specifically about the different ranges. But one thing to be aware of, and again, something to discuss with your healthcare provider, is that each individual, so we have this wide range, and typically the range for TSH, let's say for thyroid stimulating hormone, it slightly varies depending on the lab, but it may be anywhere from around 0.5 to about 5. Well, that's a big range of normal, right? So it's basically saying, okay, if you have a level of TSH that's 0.7, that's normal, but so is a level of 4.2. Well, that's a big difference, right? But what's important to keep in mind is that studies have been done actually showing that each individual has his or her thyroid hormone set point, meaning that what's normal for you may not be normal for me, and vice versa, of course. Sometimes we may know what this set point is based on previous normal thyroid testing, and then we see when there's a shift or when there's a fluctuation. And sometimes we may not know what the baseline is, depending on whether somebody has had tests done when they were free of symptoms. So, but studies have shown that this TSH set point, or this TSH, varies by about 50% in each individual over time. And generally, as we get older, this TSH tends to go up. And there's a lot of debate in the literature about whether we should have new ranges depending on different ages and so on. And then in pregnancy, of course, there's a very specific range that should also be kept. And generally, obstetricians and gynecologists or fertility specialists generally like an endocrinologist like the TSH to be less than 2, still within the normal range, but less than 2 in a pregnancy state, or if somebody is trying for a pregnancy. But let's say you have had a history of TSH that's 1, so that's within the normal range, and then a couple of years later, you start to have some mild symptoms, and your TSH is 4. So technically, both numbers are in the normal range, but clearly, you went from 1 to 4. Your TSH really increased by 4-fold or 4 times. So this is something that, again, seemingly on labs, everything looks normal, but something to definitely address with your doctor as a concern of, well, look, this is not my baseline and I'm having some symptoms. Do I need to be treated or monitored more closely? Or what should I be doing? These are the kind of questions you should be thinking about and asking. So what about these other tests? So oftentimes you may see your physician check free T4, total T4, total T3. Well, studies have shown that these vary by about 25% in each individual over time. And these variations are not dependent on cycles. They actually even looked at women that are having menstrual cycles, and they found that even throughout the month, it should be roughly the same and really not vary by more than 25%. So same thing. There's a wide range of normal. But if you notice that, hey, my free T4 a year ago was such and such value, and now the variation is much greater than 25% of what it was before, maybe this is something to look into. Maybe there's a trend that's emerging that should be paid attention to. Okay, so what causes hypothyroidism? So we know that there's a genetic component that I mentioned, and then there's the environmental component. And we're going to go through some of these environmental. But just to give you a brief list of things, and this here, again, we're focusing today on the autoimmune thyroiditis or autoimmune causes of hypothyroidism, but it's important to note that hypothyroidism can emerge because of an abnormality in the pituitary gland, which I mentioned earlier, which regulates thyroid function. It can also be due to a surgery, thyroid surgery, or a mass. So there are obviously there's more than one reason as to why someone may be hypothyroid. But today, we're going to mainly focus on this autoimmune thyroiditis. And then hypothyroidism can also occur as a result of certain medications. So as I mentioned, there's a genetic effect that's been estimated to be 60 to 70%, but the other 30 to 40% may be up to us and our habits. So let's examine those. We know that it's also associated with other autoimmune conditions, and specifically celiac, which I'm going to talk about a little bit more. And then the gut. So intestinal permeability, or something known as leaky gut, is a factor that has been proposed and explored in the context of autoimmune disease, including autoimmune thyroiditis. And we're going to talk a little bit about the mechanism here actually as well. It's quite fascinating. And then again, what happens when we have a leaky gut? There's an increased exposure to toxins. We may activate our immune system, and as a result, this may lead to autoimmunity. There are also infections that have been linked with hypothyroid symptoms and autoimmune thyroiditis. And these infections include the Epstein-Barr virus, Yersinia, which is another pathogen, and B. hominis, again, another pathogen, another parasite. Nutrients. So nutrient deficiencies, as I mentioned, can also play a part in hypothyroidism, and we're going to talk about these in more detail. And again, this is a slide that I don't want this to be too intimidating, but essentially what we're showing here is that there are these different types of white blood cells. White blood cells are cells that fight infection. So there are these different types of white blood cells, these CD4 T cells, that recruit this other group of white blood cells, other group of infection fighting cells called B cells. And they also recruit these CD8 cells into the thyroid. And what happens when these cells get into the thyroid, they cause death of thyroid cells. They destroy thyroid tissue. And this can be due to the antibodies that they produce. And antibodies are essentially shown right here. Antibodies are these proteins, essentially, that these infection-fighting cells produce. And antibodies normally help us fight infections. But sometimes, unfortunately, they can turn against us. And they can actually treat our body as a foreign substance or as a pathogen, as an infection, and then start destroying organs. So in this case, we have some of the antibodies destroying the thyroid tissue, but we also have this other mechanism of thyroid cell destruction. And so if you can imagine, when we destroy a critical or above a threshold fraction of the thyroid tissue, we get underactive thyroid because the thyroid no longer has the capacity to produce all the T4 that we need. And so this is when we may encounter hypothyroidism. So let's go to the concept that I mentioned a couple of slides ago, intestinal permeability, leaky gut. What does this mean? Is it even real? So here I'm showing a section of our intestine. And so if you can imagine, this here is the inside of our intestine. So just where the food passes, where anything that we come in contact with, anything that we eat or drink, this is where it passes through. This is a single layer of cells in our gut that has a number of different functions, one of them being a barrier function, right? So it's supposed to selectively allow nutrients to pass through, but it's supposed to keep away any potential agents that could be causing an infection. So any pathogens, any bad bacteria, any toxins, pesticides, anything else that we're ingesting that's essentially bad for us. So in the normal scenario, we see this on the right, and this of course is a blood vessel that then transports everything that gets through to the rest of our body. So normally we have this beautiful barrier here. We see that these cells are very close together, very, very tightly grouped together. However, when these tight junctions start to disintegrate, when we start to get damage right here, and the damage could be due to a number of factors, and I'm going to discuss some of them, but it could be due to the standard American diet, due to the toxins that we may be consuming as part of the standard American diet. It could be due to an imbalance of gut bacteria. It could be due to certain medications, including antibiotics, and the list goes on. But if we do find this compromise of the integrity of this gut wall, bad things get through and toxins get through. So what are some of the things that can cause leaky gut? Well, food additives, which compromise, as I said, this integrity of the gut wall. And some of the things that we may see in the food additives could be anything from different emulsifiers. They could include added salt, added sugar. Again, anything that may be the component of this standard American diet. Gluten can also contribute to this, and we're going to talk a little bit more about gluten and some of the studies on gluten and Hashimoto's thyroiditis or autoimmune thyroiditis that can lead to underactive thyroid. But these are some of the things to consider. And then here's just a list of some of the food industries, right, that can potentially be implicated in developing of this leaky gut. And then, of course, the leaky gut causes more inflammation. More inflammation can cause autoimmune disease. Stress can also affect a leaky gut. So chronic stress has actually been found to impair this gut lining that I talked about in the colon, and it impairs the barrier function. So bad things, again, toxins get through, and this has been shown in rats. The study was published in rats. So what about the gluten connection? So we know that some people may have celiac disease, and again, this is a very small percentage of the population, about 1% has celiac disease. But what about people who don't have celiac disease? Well, gluten can still increase intestinal permeability. It increases oxidative stress, so potentially can increase damage or cause oxidative damage to the lining of the gut. It affects how genes are expressed. It affects our gut bacteria and the balance of the gut bacteria. It can have inflammatory effects as well, and it can increase cell death and decrease the differentiation of cells or specialization of cells. So I'm going to talk about a couple of studies here. So this is one study that showed that gluten-free diet for 6 months reduced thyroid antibodies, right? We talked about thyroid antibodies as something that's produced by these white blood cells, these infection-fighting cells that can also turn on us, right, and cause autoimmune disease. So following a gluten-free diet for 6 months in this particular study reduced thyroid antibodies, so reduced this inflammation, this immune system activity in women with Hashimoto's thyroiditis compared to controls, or compared to women who are not consuming a gluten-free diet. There's another study, and this was a very, very small study and certainly something that's an area of interest, but there's an even more extreme nutritional protocol that some functional medicine physicians may recommend in certain circumstances, and it's called the autoimmune protocol diet. And it's something that, again, in the circumstances of autoimmune disease, may be used and may be helpful to calm down that immunity. So this was a study that was done on people with Hashimoto's thyroiditis, so with autoimmune thyroiditis, where the subjects of the study were advised to follow this autoimmune protocol. So not only was gluten removed, but all grains removed, legumes, nightshades, dairy, eggs, coffee, alcohol, nuts, and seeds. And also, of course, refined or processed sugars, oils, and food additives, all of which we know can cause leaky gut. So now, as you can imagine, there are a lot of food groups that were removed here. And this is something that by no means would I recommend that anybody do on their own. It's really important when following any type of elimination diet or any type of very restrictive diet to be followed by a qualified healthcare professional, because these diets, because they're so restrictive, they can actually cause nutritional deficiencies that can be very dangerous. And generally, these types of diets are not meant to be followed long term. It's a way to calm down the inflammation, reset, and then slowly add in some of the food groups that are not irritating, but with the goal of removing some of the food groups long term. For instance, we know that refined and processed sugars are bad for us, that food additives are bad for us, and so on. And then for some people, they may need to stay away from some food groups lifelong, but certainly the goal is not to restrict to the extreme where people are having anxiety about, well, what am I going to eat for the rest of my life, and how am I going to even get my nutrients? That is not the goal. And so these people were in the 6-week elimination phase. So they were slowly starting to eliminate these food groups, and then 5 weeks of maintenance phase. And then after those 11 weeks, they were gradually instructed to reintroduce some of these eliminated foods. And there's some evidence, the reason that this study was done, and one of the things that they talked about was that there's some evidence that autoimmune protocol diet had been used successfully in inflammatory bowel disease. So this diet has shown to be promising, but we still need more data. There's just not enough information. But What we did know is that from this small study of 17 participants, these were all women with Hashimoto's, premenopausal adult women, after this autoimmune protocol, an inflammatory marker called CRP was significantly reduced. Their health-related quality of life and another health-related symptom questionnaire significantly improved. The antibodies, however, and thyroid function tests did not significantly improve. But 3 of the 16 subjects that completed the study, because only 16 completed, 17 enrolled, but 16 completed, reduced the thyroid hormone dose, perhaps suggesting that they were able to recover some of the thyroid function. So I think this is really exciting and promising research. We definitely need a lot more data. We need to check if this is reproducible, if this is something we can actually use routinely in clinic. But this is a great first step in understanding a strategy, a lifestyle, a nutrition-based strategy that can be helpful. Another study that was done showed that people with autoimmune thyroiditis, meaning they have positive thyroid antibodies, they tended to eat more animal fats and butter. Whereas people with low thyroid antibodies typically ate vegetables, dried fruit, nuts, and muesli. And the authors hypothesize that this protective association of these types of food groups and of course plant-based are that they were getting omega-3 fatty acids and they were getting a number of phytonutrients from these plants. Whereas it could potentially be that it's pro-inflammatory to have the saturated fatty acids of animal origin. And I know this is an area of big debate in the literature, but again, I'm presenting you with studies that have been done in this area just to raise your awareness and something that that is really important to know. And again, this type of association may not mean that there is a cause-effect relationship. It just means that the authors observed this association. So we further have to elucidate and understand, well, what's the mechanism behind this? So now let's briefly talk about some of the key nutrients to check. And I know that we're already past the 1 hour mark, so I'm just going to plan to wrap this up. But what are some of the key things that clinicians should check when they find that thyroid function has been compromised and there's thyroid autoimmunity? Iron is really important to check. Vitamin D status, and of course, correct any vitamin D or iron deficiency. Adequate selenium intake is vital. And this is especially in areas of iodine deficiency or excess. And selenium can actually be quite protective in terms of the inflammation and the oxidative stress that can occur. But again, this also should be used with judgment because there's no intervention that is without risk. And of course, if we're supplementing a nutrient, we need to be monitoring it. And we need to understand why we're supplementing it. Is the patient deficient? How are we expecting this nutrient to help support the patient? And so on. But there's definitely some evidence that selenium can be helpful and that higher selenium was associated with a lower odds ratio of autoimmune thyroiditis. So if you have higher selenium values, less likely to be associated with autoimmune thyroiditis, but also hypothyroidism or underactive thyroid, subclinical hypothyroidism, which is just another milder form of underactive thyroid, and then enlarged thyroid as well. And one of the reasons that I also mentioned selenium is that our soil is getting depleted. So selenium is decreasing in our soil because of the way that we farm. So even if we are eating a plant-rich, diverse diet, it's still important to check levels, make sure that we're not depleted. And also, if we have issues absorbing from the gut, we may be ingesting the right amount, but maybe we're not absorbing all the selenium. So again, important to check in case of thyroid disorder. Iodine, as you know, iodine is a building block of thyroid hormone. So this is extremely important to check and make sure that you're getting enough. And again, you may be getting enough from your diet, or you may require some supplementation. So something that definitely should be checked. Typically, iodine is checked in urine. It is a test that is generally used to look at population iodine deficiency. And if you look this up, actually, academic sources will say, and clinical sources will say that it's not something that should routinely be used to necessarily check a particular patient's iodine level. But I've certainly found that it can reflect the iodine status in a patient, especially if you get it over time and you find that iodine is consistently low. Your clinician may decide to supplement because it is really important. Now, zinc. Zinc has a number of different functions in the body, and it's very important in both cell division and immunity. But it's also important, if you remember from a graph a few slides ago, that it's important for the conversion of T4 to the more active form T3. So some people may have trouble absorbing zinc for various reasons. So again, it's important to check the zinc status, supplement if needed, or boost zinc with some of the dietary sources that are available and that are rich in zinc. And then iron. Iron deficiency is something that's not uncommon, especially in women of reproductive age, especially due to the blood loss from menstrual cycles. So this is something that is important to screen for and be aware that if it's present, it's something that should be addressed, again, dietarily and or through supplements as well. Vitamin A, again, another vitamin that's very important in not only vision, but also immune function, reproduction, growth, and development. And it has been shown to help suppress this thyroid stimulating hormone. And actually a study that was very small, but in healthy women, showed that supplementation with vitamin A can increase T4, again, the more active form of thyroid hormone, and can decrease T4. So it can increase T3, but decrease T4, implying that vitamin A plays a role potentially in increased conversion from T4, a little less active, to T3, a more active form. And again, we need more research to determine when to supplement with vitamin A and also what doses are appropriate. It's also estimated that the risk of vitamin A deficiency is very low, less than 1%. But also it should be recognized that we haven't quite defined optimal levels of vitamin A for thyroid function. It's also something that comes in different forms, beta carotene and retinol. And retinol is the actual active form. And there's an enzyme that facilitates conversion from the beta carotene to retinol, the active form of vitamin A. And this is something that varies in all individuals. So it's really important that if your doctor checks vitamin A, that they check the active form to make sure that you're actually converting it properly. And again, it's important to know that vitamin A can cause toxicity and actually even increase risk of cancer in smokers and people that work with asbestos. So this is something that's important to, again, discuss with your doctor, just like with all of the other supplements. Now, vitamin D has been linked to a number of health benefits, right? We know that it's essential for bone health, preventing osteoporosis, but has also been implicated in autoimmune disease, blood sugar regulation, as well as cancer. So if we have low levels of vitamin D, this has actually been correlated with autoimmune thyroiditis. And research shows that this condition can actually be improved if we supplement with vitamin D. So one way to get more vitamin D is spend more time in the sun, but of course we need to be mindful of our sun exposure and UV exposure for our skin and risk of skin cancer. But also we can add foods that are rich in vitamin D. And we can also take a vitamin D supplement. So again, something that I check for my patients and something that I recommend that gets checked periodically, depending on what your levels are and whether you're being supplemented. Vitamin D is very important. And now we already talked about the gluten-free diet and this implication that gluten can cause intestinal permeability. And that although celiac disease is very rare, individuals with autoimmune hypothyroidism are 4 times more likely to have celiac disease. So actually, some researchers suggest that individuals who are diagnosed with Hashimoto's or with autoimmune thyroiditis have diagnostic tests for celiac disease. And now celiac disease can be asymptomatic or present with no symptoms, or it can present itself with gastrointestinal symptoms, skin disorders, reduced fertility, neurological symptoms. So it's really important to um, uh, to to work with a clinician who can recognize these signs, and then again, if indicated, test for celiac disease. And the other piece that's interesting is that a study showed that most individuals who have thyroid disease and celiac disease, if they eliminated gluten, they had improvements, or at the very least improvements or normalization in their thyroid tests. So that's very exciting. So the gluten connection, celiac disease and other autoimmune conditions. So this is something that, again, I mentioned celiac disease correlates with increased risk of thyroid autoimmunity. And then if you don't have celiac, we already talked about what are some of the risks of gluten. And then soy, oftentimes we hear that, soy can have negative effects on the thyroid. But as long as the iodine levels are normal, soy should not have a negative impact on the thyroid gland. And there was a literature review of 14 studies that found that soy has no effect, or at the very least, it modestly affects thyroid function. So again, something to discuss with your physician. And then stress, we already talked about the implication of stress on leaky gut, but also even on autoimmunity, as well as on that conversion. If you remember that slide from the beginning of the talk, if we have increased stress, we're going to want to slow down that metabolism and reduce the active T3, and then we may feel effects of underactive thyroid. And again, this is beyond the scope of this presentation, but stress management is extremely, extremely important, and one of the topics that I talk about quite a bit. So definitely tune into my future talks and my content if you're interested. How do I actually practically deal with stress? And then low calorie diet. We talked about this as well, right? If people are significantly restricting their calories, they may risk lowering their T3 levels and slowing their metabolism as a result, because again, the body tries to adapt. And there was also a study that was reported that when a patient removed sugar substitute, aspartame, Hashimoto's thyroiditis resolved. And the infections, I already discussed this. So with any gastrointestinal symptoms especially, it's important to be tested for an infection to make sure that this isn't something that could somehow be contributing. And there was actually a really interesting case report where somebody was affected with an intestinal parasite, and their thyroid function was abnormal. Their thyroid tests were, thyroid antibodies were abnormal. And once the parasite was treated, thyroid function normalized. So let's do a quick case study before we wrap it up. This is a 36-year-old female with fatigue and weight gain. She was found to have normal thyroid function, but these antibodies were high. The TPO antibodies were 207. And she did have Epstein-Barr reactivation, and her iron was borderline low. Her vitamin D was 28, so technically within the normal limits by the Institute of Medicine, but perhaps not in the optimal range, according to a number of research studies. And then all of the other nutrients that were checked were within expected ranges. But stool tests found abnormal balance of bacteria in her gut. There was a deficiency in good bacteria, and there was an increase in bacteria that are potential triggers of autoimmune response. So what do? Anti-inflammatory diet, rich in plants. We want to eliminate sugar, eliminate gluten. We want to consider eliminating dairy as well. Again, that autoimmune protocol diet did show some promise. I don't know that I would necessarily go to that extreme, and I certainly don't do that with every single patient, but that's something that potentially could be considered. And then some of the goitrogenic foods, for example, like cruciferous vegetables, you may want to steam them because they have been correlated with development of goiter or enlarged thyroid. And we also just don't want to consume some of these goitrogenic foods in excess. We want to address any nutrient deficiencies. So in this particular case, the patient's iron and vitamin D, the suboptimal vitamin D was addressed as well. address intestinal permeability and support the microbiome. So we may want to do that again by eliminating gluten, eliminating sugar, eliminating any food additives, processed food. We want to support the microbiome with good prebiotics. We want to support the microbiome potentially with probiotics that can be helpful. Reduce the toxic burden, right? And support our body's ability to detox. We want to consider supplements to suppress Epstein-Barr reactivation and address any other infection. And again, we want to work to master stress and get adequate sleep. Within 6 months, energy improved, weight was stable after these interventions, and the tests were repeated 1 year later. So the TPO antibodies, these thyroid antibodies that were attacking the thyroid, went from 207 to 123. So they were still elevated. However, they went up a little bit. Thyroid function tests were normal, but interestingly, this TSH, the thyroid stimulating hormone, went up a little bit. So again, this may be something that's within the range for this patient, or it may be something that, again, we need to monitor and it's creeping up and we may eventually need to treat. And then the other thyroid antibodies were negative. So again, in this particular case, we'd want to monitor symptoms as well as the thyroid function test and address clinical hypothyroidism with thyroid hormone supplementation if it occurs, but then also support the anti-inflammatory processes as well. So in summary, what we want to do, and ideally, what I hope that you find as well in your journey, is a practitioner that can really combine the root cause with evidence-based medicine. So we want to address the foundations of health. We want to achieve balance and really support our mind-body, empower and support with nutrition and targeted supplements when indicated. And then we may want to treat, of course, if indicated, with medications. And it's so important to work with a qualified healthcare practitioner and a health coach to receive the appropriate support in making these gradual lasting changes. And I love to use this quote for collaborative approach: when I is replaced with we, even illness becomes wellness. Thank you so much. It's been such a pleasure.